Zubairu Babajide Atta, and it's 11 o'clock. Would like to welcome you. I can see my mentor, Olusola Macaulay from UNESCO, about to sit in place. Would like to welcome you to this Bako Kontagora Development Foundation webinar with the theme Post-COVID-19 Good Governance, Prospects and Challenges for Promoting the Socio-Economic Well-Being of the Urban and Rural Masses. I have been a volunteer with the Bako Kontagora Development Foundation, where we've done work in rural communities, encouraging education mainly through the flagship project called the Anti-Goma Foundation, a teachers movement, whereby rural and urban poor women organize school children to give them the basics in education without being in a formal school structure. And that's because most of the parents will not be able to afford schooling for their children in the formal sector. And this has been able to raise up the educational standard of children to the point of where the parents all can afford sending their children to school, paying in formal schools, maybe through kindergarten to primary school or whatever. And it's developed into a kind of blockchain of such rural interventions. And then the foundation has also embarked on school feeding and community feeding programs, where I have volunteered to do that as well. We get some high-level persons or high-profile persons to volunteer to go into schools in rural communities that are hitherto been neglected, whether at the government level or at the community level. And this time now, that's why you notice that in the past, all the webinars that have been organized are for the urban and rural masses, especially in this COVID-19 scenario that we find ourselves, which has disrupted almost everything about the social life, everything about the social fabrics of communities all over the world. So it is very important that these erudite scholars here, erudite practitioners, key opinion makers and molders in community have been invited to form a faculty that will will give advice on how this issue, the challenges for promoting socio-economic well-being of the urban and rural masses will go. We're talking today about human development. Before I go on, I'd like to introduce my co-moderator, Mr. Olusola Macaulay. He's like a kind of mentor to me, who has taught me a lot about the kind of things I do, especially when it comes to strategic communication and community intervention issues. If Olusola Macaulay is available, he works with UNESCO. I think he's the desk officer in charge of communication. If you look at the poster, you'll see that Mr. Macaulay's, where he's there, he doesn't like to put his picture on these things because he's representing an organization, but he's one of the key motivators for helping community social enterprises like the Bako Kontagora Foundation to make an impact in various communities. So he will be the co-moderator. I'd like to invite Mr. Olusola Macaulay to say over.
Yeah, good morning, Professor Atta. Please allow me to call you Professor because you keep saying I'm your mentor.
I don't know.
So you taught me how to mentor, so I don't know what I have to call you other than being professor. Good morning, all colleagues. I sincerely want to say it's been an honor for me to be here this morning and to be part of this heartwarming event of Bako Kontagora. Bako Kontagora Foundation has been one CSO that UNESCO has partnered with in the past in making sure that we get to the grassroots. And I know that today's event will be one of the events that will, not just because we want to bring people together on a platform like this, but to find a solution to several other problems that we have in our environment, particularly as relates to the targeted area. Once again, I want to welcome you all to this, and I know that at the end of this meeting, you agree with me that you've not wasted your time, but rather you've been part of the contributor to the country called Nigeria, and that we are looking forward to see a social change in the not in the long distance, I mean in the long time, but very close distance, especially as we all are working to make sure that we mitigate the crisis that COVID-19 has brought to the society. Once again, allow me to say big welcome to you all. And I know that Madam Bakoy has said, will be able to say, yes, the people that have come today are people of excellence. I've seen Dr. Suraj from University of Lagos. Dr. Suraj is a homemade of UNESCO, and we are happy to see you. And I know that the Commissioner of Health is here, if I'm correct. The Commissioner of Health for Kaduna State, Dr. Hamina, is here. I've seen Professor Ade Poju on board. That's the DG of Forestry Research Institute of Nigeria. We are equally expecting Miss or Mrs. Indede, the managing partner for Shell Consulting Agriculture and Nutrition Limited, as well as Hakeem Subrao, founder and CEO of 1 Million Teachers. Dr. Suraj have said, Professor Dama, the senior lecturer at University of Abuja. You can see we have all of them here. This is a key activity that we've been all waiting for. Once again, over to you, Dr. Atta.
Thank you very much, Mr. Macaulay. Right away, I'd like to introduce Hawa Bako Mohammed, who is an economist, and she's just concluded her master's degree in financial economics and a postgraduate diploma in management from the Nigerian Defense Academy. She's done lots of work and study with the Harvard Business School Executive Education Program, specifically with emphasis on governing for nonprofit excellence. She's an associate of the Nigeria Institute of Chartered Economics and a member of the Chatham House, United Kingdom. She has a lot of experience in national policy dialogue generation and creation processes, having served as a volunteer to the Senior Special Advisor to the President on National Policy Development Analysis. And specifically, actually, that's where we met. And I know there's somebody else here on the faculty, Aisha Abdullahi Buba. I think that's where we met her. So we're very happy to have her. You can read her profile here. It's not about us now. It's about the issues that we're going to discuss and to find out impactful ways that we can socially interact with our communities and our loved ones. She has been the Chief Executive Officer of the Hawa Bako Green Acres Farm and Agro Allied Limited from 2015 till date. Her brother Aminu is on somewhere. He may be in a place where the network is not too good, but I know he's on. He's viewing this, and perhaps in good time he'll be able to talk about it. Ladies and gentlemen, the faculty, I'd like to call on Hajia Hawa Bako Mohammed, the founder and chief operating officer of the Bako Kontagora Development Foundation. Over to you, Hajia Hawa.
Esteemed colleagues and friends, ladies and gentlemen, today's session is devoted to the theme post-COVID-19 good governance, prospects and challenges for promoting the socio-economic well-being of the urban and rural masses, part 1, human development. This is a theme which is particularly relevant in the context of our common aspiration to attain inclusive and sustainable development on the global, regional, and national level. It is an opportune time to discuss problems of mutual interest and exchange ideas on the innovative and cost-effective ways the government and stakeholders can improve human capital post-COVID-19 to achieve key sustainable development goals. Last month, the United Nations Secretary General Antonio Guterres said the COVID-19 pandemic has exposed the fragility of our world and laid bare risk we have ignored for decades. The pandemic has thrived amid the inequalities of our societies and the gaps in our systems. Racial and social inequalities, poor governance, poor infrastructures for education, healthcare, and the politicization of social welfare programs. All of this put people at risk. It is verifying that the agenda of today's webinar covers a wide range of very interesting topics relating to social welfare programs, components of quality education provision, literacy for rural urban poor, gender dimension in planning governance, mental health, environmental stability, and nutrition for the rural urban poor to prevent undernourishment. The webinar series is focused on good governance using the Ibrahim Index of African Governance, IIAG, as a framework. The 4 IIAG good governance categories are human development, safety and rule of law, participation and human rights, sustainable economic opportunity. In this part 1 of the series, our focus shall be on human development, which has welfare, health, and education as subcategories. As earlier stated, discussions shall be centered around topics that are most relevant to achieving the targets of the UN SDGs and the socioeconomic well-being of Nigerian post-COVID-19, which can also be adopted by other African countries. I wish to take this opportunity to welcome the participants from Ivory Coast, United Arab Emirates, other African countries, and the United Kingdom. These participants have joined this series of webinars for the first time. 3 months ago, BKD Foundation organized a webinar on impact of COVID-19 on rural education, a look at the forgotten button. Okay. 3 months ago, BKD Foundation organized a webinar on impact of COVID-19 on rural education, a look at the forgotten button, creators, slums, and underprivileged. The webinar was attended by over 80 participants with representatives from INGOs, Niger State government, experienced educators, students, and stakeholders in the education sector. Speakers and participants from all over the world shared their experience on the challenges and best practice solutions for scaling up successful models in the Nigerian education sector, and it should evolve from passive learning to active multisensory holistic learning. Ladies and gentlemen, please allow me to once again thank our long-standing and reliable technical partners, UNESCO Abuja, who have helped organize this. Against this backdrop, I would like to welcome Dr. Amina M. Baloni, Commissioner for Health, Kaduna State, who has been in forefront of women's empowerment activities and education in Northern Nigeria. I'm also extremely glad to welcome Professor Adepoju Adeshola, DG Forestry Research Institute of Nigeria. We're very delighted to see your active engagement in initiatives targeting environmental stability. To our distinguished speakers and discussants, Professor Nazifi A. Derma, Senior Lecturer, University of Abuja, Ndidi O. Nwadnali, Managing Partner, Sahel Consulting, Agriculture and Nutrition Limited, Hakim Zubair, Founder and CEO, 1 Million Teachers, Dr. Olunifesi A. Suraj, Senior Lecturer, Department of Mass Communication, UNILAG, and Aisha Abdullahi Buba, Psychology Services and Consultancy. We're extremely grateful for this opportunity to learn from your unique experience and expertise. I'm confident that today's event will help reinforce partnerships and facilitate the exchange of successful applicable models and practices for the promotion of the socio-economic well-being of the urban and rural masses. Thanks also to our moderators, Olushola Makoli, and our dearest Mr. Zubari Babajide Atta, for accepting to moderate. I look forward to thought-provoking presentations and fruitful discussions. Finally, and most importantly, to the young adults around the world, I say, think big and be bold. We count on you for your creativity and your fresh ideas. Your voice and engagement are needed more than ever, particularly as the world responds to this unprecedented crisis. We are all in this together, or we can only prevail together. I thank you all.
Thank you so much, Madam Hawa. Thank you so much, Madam Hawa. When I grow up, I would like to speak like you. Ladies and gentlemen, we've heard it all. We've heard the reason why we are here, and I will not want to waste so much of your time. We'll be going straight into the ingredients of the whole event today. Let me just give you this. You are aware that the crisis of the pandemic spread throughout the world. It was becoming clear that people. So I was just talking about the fact that the COVID-19 crisis, we all know how it has spread across. It is increasingly clear that the people with at least access to essential services like water feel the most dramatic effect of this pandemic. Major health organizations like the WHO has advised the reason why we need to wash our hands frequently, at least for 20 seconds to prevent the outbreak. Yet, over 3 million people all over the world, which makes almost 40% of the population of the world, lack access to basic water or hand washing facility in their home. Without wasting so much of your time today, I know that our commissioner, Honorable Commissioner for Health, Kaduna State, Dr. Amina Baloni, will be doing access and be speaking on the access to public water supply and healthcare in the city and villages. You will agree with her at the end of the day that when we talk of access to water, it is not only in the villages alone, but also in city. Abuja, where I am, I'm sure I don't even have public water in my house. We all dig borehole around our estate. So she'll be doing a great honor to us to tell us access to public water supply and healthcare in the city and villages, the current challenges. During and after COVID-19 on how to improve the plans, especially relating to Kaduna State. Once again, I want to welcome you all the participants. If you have any question, please don't hesitate to write in the chat room your question or tell us your contribution about the topic in progress. Over to you, my Honorable Commissioner, please.
So good morning, distinguished participants in this webinar. Thank you very much for inviting me. I'm very happy to be here. I'm trying to see if I can share my presentation so that it's easier to follow. I'd like to thank the Bakuk Kontagora Foundation for giving me this opportunity. And I hope that I'll give a little bit of insight into the problem of water and sanitation in the country and in Kaduna State, and what the state is trying to do about it. If I could please have permission to share my screen.
You have the permission.
Okay. I'm trying to do that. It doesn't seem to be coming. Okay. Okay. Can you see that? Okay. So thank you very much. By way of presentation, this is access to safe water supply and health, the current challenges and post-COVID-19 plan in Kaduna State. The presentation shows the background, the water and health challenges, and the Kaduna State response. So if we look at the global population, in 2017, a survey showed us that 71% of the global population had access to safe water sources. But globally, at least 2 billion people use drinking water that has been contaminated by feces, which means that you cannot classify that in any way as a safe water source. Contaminated water, as we know, has various health implications. It can cause diarrhea, cholera, dysentery, and typhoid, and it's estimated to cause about 485,000 deaths each year. Coming to Nigeria, 66% of the households in Nigeria have access to improved source of drinking water. But there's an urban and rural divide, which the urban areas have better access to water compared to the rural areas. This map is giving us a snapshot of what the picture looks like in the country. And you can see that Kaduna State has 63%. You can locate your states. Those that have 80 to 90%, Jigawa, Osun, Ekiti, Imo, and Abia. All others have varying challenges. When you look at the northwest zone where Kaduna State is situated, you can see it's variable across the northwestern zone, with Sokoto having the least and Kaduna coming in about 63% of coverage of the population. If you look at what the major households in Kaduna, Nigeria, think what they classify as bottled or pure water, which is what they classify as a good water source. In both rural and urban areas, you can see that it's just 34% and 41% respectively. And you can see all the others: water from a tank, rainwater, protected spring, dug well, protected dug well, tube or well borehole, and the like. So contaminated water and poor sanitation are linked to transmission of diseases. Like I said before, some of them are water, diarrhea, dysentery, hepatitis, typhoid, and of course polio, which is quite topical. Yesterday, Nigeria and indeed Africa was presented with a certificate of being polio-free. And one of the great challenges we had in eradication of polio was actually the environmental challenge of poor water and sanitation, where the polio virus could hide and therefore continue to spread. Diarrhea, of course, is the most widely known disease, and it comes from contaminated food or water, but also other hazards. And in the 2018 National Demographic and Health Survey, the report shows that the prevalence of diarrhea in children under 5 is 13%, while that of Kaduna is just a little bit behind. Here I've tried to show you the categories of water-related diseases. You have waterborne diseases, which are enteric infections, which means that you get it through contamination of feces to drinking water or anything you ingest. These are outlined out. Water-washed diseases, and this is spread due to insufficient personal hygiene or insufficient water for personal hygiene, and you can see that trachoma is one of them. Water-based diseases, where such as schistosomiasis, where part of the organism that causes this disease spends part of its life in water. And then you have water-related diseases. These notable among which is malaria and trypanosomiasis, where the vectors requires access to water to thrive. So coming to Kaduna State and the challenge, the general household survey in Kaduna State revealed wide geographic inequalities, showing us, I'm sorry about that, where, you know, there's a, I'm lost somewhere. Okay. Yeah. My presentation is frozen. Okay. Yeah, the challenge. So the household survey showed that you had geographical geographical inequalities in terms of access to safe drinking water. Again, the rural areas have less access than the urban areas, 34.1 to 66.3%. The senatorial zone, the southern senatorial zone, had more access than the northern senatorial zone, 59.7 to 40, in the central zone in between. And Kauru local government had less access compared to Kaura, which had the highest, so between 22 and 75. We all know that water and sanitation play a crucial role in health and well-being of the people. And in 2010, the UN General Assembly recognized the human right to water and sanitation, and concluded that everyone has the right to sufficient, continuous, safe, acceptable, physically accessible, affordable water for personal and domestic use. In Kaduna State, the water sector is managed by the Ministry of Public Works and Infrastructure, which is responsible for policy, sector coordination and research. And we have several agencies, such as the Kaduna State Water Corporation, the Kaduna State Rural Water Supply and Sanitation Agency, and the Kaduna State Water Regulatory Commission. In our COVID response, RUWASA played a major role. It's a major member of the Emergency Operations Committee, and it supported the state to carry out the campaign on hand washing, on provision of safe hand washing facilities, demonstration, engaging community members that belong to the WashComs. These are water and sanitation committees, to support the community effort of adhering to those public health rules, as well as environmental sanitation. And they provided a lot of hand washing facilities in public places, including schools, offices, markets, motor parks, school and health facilities. So post-COVID, the health sector response, what we have in the state is a public health law, where you can actually regulate and enforce the use of safe water by the population. In our Kaduna State Second Strategic Plan, 2018 to 2022, we have a strategic objective of promoting universal access to safe drinking water and acceptable sanitation. And the aim of this is to reduce the incidence of diseases from consumption of unwholesome water and poor sanitation by 50% by 2022. Various strategies are being implemented and planned for post-COVID. Continue, of course, with our provision of safe water and sanitation facilities, promoting hand washing, development of other policies and plans, and their implementation. Already, the state is in partnership in 23 LGAs with UNICEF for provision of water and sanitation across the state. And then the behavioral change component, we need to reinforce till people change their behavior about hand washing, about safe hygiene practices, about sanitation. And we do that as we are continuing in the COVID response and beyond. So thank you for listening. That's my presentation.
Thank you, Honorable Commissioner. Well articulated. We've heard that all the work that the government of Kaduna is putting in place in terms of promoting access to water, especially to reduce diseases. Also talked about the behavioral change of the use of water among the people. She did mention of the effort globally on the need for a huge capital investment that is required to meet the global needs of water supply, sanitation, and hygiene services. So once again, Honorable Commissioner, I want to thank you on behalf of PACO Foundation for the good work you are doing. Please, ladies and gentlemen, you may put in your question in the chat room. The Honorable Commissioner is willing to respond accordingly. And I suggest that if you have more other questions, don't hesitate to ask, especially as relate to the presentation of Honorable Commissioner Amina Maloney. Thank you, Madam, for a good presentation. We need to go further to look at the environmental policy of the government in promoting environmental sustainability in the light of COVID-19. What are the government doing? What do you think we can do to support the government in terms of policy? And that is why we are having the Forestry Research Institute, DG in Nigeria, Professor Adepoju Adeshola. Please, Professor Adepoju, over to you, please.
I started by welcoming everybody. Today's a wonderful webinar program organized by Bakukutu Grad Development Foundation, and to thank them for inviting me as a speaker in this first webinar series themed post-COVID-19 good governance, prospects and challenges for promoting the socio-economic well-being of the urban and rural masses, part 1. It is with utmost great delight and singular honor that I will be addressing our esteemed participants on the topic, environmental policies, initiatives of government to promote environmental sustainability in the light of COVID-19. This webinar is coming at a good time, given the all-encompassing challenges and changes and unprecedented scenarios created by global pandemic outbreak on all facets of human activities, environment, and economy at large. Protection and sustainable use of environmental resources is essential for sustainable development and human well-being. The natural environment is humanity's first line of defense against many hazards, and a healthy planet is a prerequisite for healthy people, and that in turn is the foundation of a healthy economy. The COVID-19 pandemic has impacted positively and negatively on biodiversity conservation, as well as environmental sustainability. Positively, in the area that the lockdown had helped people to stay indoor, and this had helped reduce the greenhouse gases emission, as well as allowing the regeneration of a lot of shrubs and plants. It has also helped to reduce transportation, air travel, and industrial emission. As a result, air and water quality improved, noise pollution declined in some places, exploitation of natural resources also declined. Most notably, daily global carbon dioxide emissions have abruptly decreased in the initial months of the global lockdown. Human confinement and restriction. Okay, as a result, air and water quality improve. Sorry, I'm missing up something. Okay, fine. Restriction on human mobility on the other hand, are negatively impacts. Lack of mobility had aggravated unemployment and economic insecurity, which may explain reports in remote and rural areas of increasing wildlife foraging, illegal fishing, habitat conversion for agriculture, and other resources extraction activities that support livelihood but also pose biodiversity threats. In many places, decreased conservation enforcement because of the pandemic lockdown is facilitating poaching and illegal activities in the forest ecosystems. Restriction on human mobility, on the other hand, had negatively impacted us. Lack of mobility has aggravated unemployment and economic insecurity, which may explain reports in remote and rural areas of the various activities that are illegal. In many places, decreased conservation enforcement because of the pandemic lockdown has also contributed negatively. Unfortunately, overexploitation of ecosystem predictably, this is expected to reach 8.6 billion by 2030 and 9.8 billion by 2050. In addition, by 2050, 68% of human population is predicted to live in urban areas. This exponential increase in population and urbanization will have implications for the demand for resources, including food, infrastructure, and land use. All these, therefore, call for concerted effort and holistic approach through collaborative, collective, and coordinated action by government, businesses, finance, consumers, civil society, scientific and technological communities in promoting environmental sustainability and socio-economic well-being of the citizenry, while at the same time providing a pathway to prevent or manage future pandemics. At this junction, and because of time constraint, I will go straight to the topical issue: policies and initiatives of federal government in promoting environmental sustainability in the light of the pandemic outbreak. Recently, the Honorable Minister of Environment, my boss, got approved after presentation at FEC, the National Forest Policy, which has an adjunct Council of National Forest Trust Fund. One of the commitments of this policy is to drive the federal government in promoting environmental sustainability, especially in the light of COVID-19, is the recent approval of a new national forest policy to safeguard the nation's ecosystem, sustainably manage its vast forest resources, as well as boost the current effort of addressing various climate change in the country. The new National Forest Policy, which is a revised version of the approved 2006 policy document, is guided by a vision of sustainable management of forest ecosystem, socio-economic growth, environmental sustainability, and provision of goods and services for domestic and export purposes, all for the benefit of the country. Establishment and operationalization of National Forest Policy Trust Fund as an alternative means of funding forest development activities in the country is another policy drive of federal government. In 2006, National Forest Policy became obsolete in the light of emerging and contemporary developmental needs of the country, necessitating a new policy document that is all-inclusive and aligning with current global trend. Subsequently, the new forest policy document is objectively positioned at achieving sustainable management of forest and forest resources that will ensure sustainable increase in the economic, social, and environmental benefits for the country's present and future generation. On the other hand, in the light of post-COVID-19, the new policy is aimed on the necessity for a more robust and continuous socioeconomic development that provides optimal benefit to the people at large in a sustainable managed environment that will contribute to achieving the sustainable development goals. Environmental challenges relating to deforestation, wanton exploitation of forest and forest resources, excessive harvest of firewood, conversion of forest land to agricultural lands, exponential population growth, infrastructural development, insecurity, and insurgence in the forest, among others, have been notably identified as factors contributing to decline in forest and forest resources in the country. This resulted in rapid forest loss from 10% to the current 6%. In fact, land use change deforestation has been estimated to be linked to 31% of the outbreak of emerging infectious disease, including HIV, Ebola, and Zika virus, which are considered connected to anthropogenic changes in tropical rainforest. With 15% of these infectious diseases linked to agricultural changes. Number two is the massive afforestation, restoration, and reforestation policy of government. We all recall that on the 23rd of September 2019, His Excellency, the President of Nigeria, President Muhammadu Buhari, pledged at the UN of Nigeria planting 25 million trees. This will help Nigeria to move from our present 6% to 25% of forest cover that is internationally recommended. This pledge is in furtherance of Nigeria's commitment and aspiration to its obligation under the Paris Agreement to ensure a resilient future, steady progress of national determined contribution, and increase in the national forest cover. In fulfilling the federal government's national targets commitment and demonstrating Nigeria's readiness in the increasing Nigerian total forest cover, equally addressing climate change and other attendant environmental challenges, the Federal Ministry of Environment has taken the giant stride of full implementation of 25 million trees planting with states like Kaduna, Nasarawa, Ogun, Niger, Adamawa, Bauchi, among others, taking the lead. And I must thank the governor of Kaduna State at this point for taking the lead of also giving us the sacred land where we to continue to do the planting, and for being the first state to take its 1 million tree seedlings from our Kaduna station. The outcome of this initiative is expected to provide significant economic, social, and environmental benefits in terms of job creation, economic growth, and sustainability, improve socioeconomic livelihood, social equity, and development, veritable carbon sink to address climate change mitigation and adaptation, reduction in greenhouse emission, provision of ecosystem services, biodiversity conservation, reclamation of degraded land, desert encroachment control, and ultimate increase in forest cover. The third policy document of government is the intended national determined contribution that is now nationally determined contribution. This is our pledge at Paris and at our various climate change meeting. Climate change has been recognized as the greatest challenge and major threat to sustainable development because of its impact on the earth, infrastructure, settlements, agriculture, and food security, and forest ecosystem. The Earth mean temperature is likely to rise above 1.5 degrees Celsius, and keeping the Earth mean temperature below 1.5 degrees Celsius is the focal objective of all global community. Over the years, Nigeria greenhouse gas emission increased by 25% between 1990 and 2014. And about 38.2% of this emission emanated from the land use change and forest sector, followed by energy, waste, agriculture, and industrial processes sector. As a policy in its NDC, Nigeria pledged to unconditionally reduce greenhouse gas emission by 20% by 2030, compared to business as usual. Emission level by focusing implementation measures on energy, transport, oil and gas, agriculture, transport industry sector. This target is expected to be achieved through increased energy efficiency by 20% and significantly reducing use of generators. Provision of 13 gigawatts of renewable electricity to rural communities that are currently not connected to the electric power grid, putting an end to gas flaring, implementing climate smart agriculture and reforestation. The development and implementation of nationally determined contribution will pave way for a low carbon economy and result in about 50% reduction in Nigeria's green gas house emission. At the same time, the economy will grow at an average annual rate of 5% by 2030. This represents an important milestone in tackling the challenges of climate change and environmental sustainability in the country. Number 4, promotion of domestic gas utilization. Finally, another policy thrust in promoting environmentally sustainable as a strike in the economic sustainability plan of federal government in the response to the challenges posed by the COVID-19 pandemic is the promotion of domestic gas utilization. This entails taking advantage of Nigeria's abundant gas resources, which is environmentally friendly, available and less expensive. This will further encourage local content development in indigenous production of gas cylinders, contribution of gas filling stations, conversion of gas to promote the wide use of compressed natural gas in the domestic market. Solid waste management policy is one of the policy documents the Honorable Minister just got through, also with the FEC. Nigeria, with a population of more than 204 million people, has been facing numerous environmental and socioeconomic problems, especially in the area of solid waste management. This is further aggravated by the pandemic outbreak, institutions relating to movement restriction, increased consumption, and accumulation arising from working from home and reduced collection by relevant authority. Introduction of new waste, particularly medical waste, and so on. The coronavirus outbreak has brought a dramatic increase in the use of medical waste, including masks, gloves, hand sanitizer bottles, protective medical suit, test kits, take-out containers, delivery packaging, and other items central to our new lockdown, hypergenic way of life. Pressing health and environmental concern related to solid waste management in Nigeria require utmost action. You can see picture of boats already taking the mass from the water in the ocean and bringing it to land again. Attention and cooperation among the federal, state, and local governments, business communities, civil society, non-governmental organizations, and the populace in general, especially in the light of the pandemic outbreak. The federal government of Nigeria is committed to the promotion of the practice of reducing, reuse, and recycle, as well as committed to support the attainment of sustainable development and the provision of environmental friendly place for the general welfare and health of the populace. Policy and initiative on solid waste management. Ongoing remediation project in Ogoni land to ensure full environmental recovery and restoration of ecosystem and ecosystem services, as well as restoring all hydrocarbon impacted community and sites. Advocacy and sensitization of the adverse use and ban of the polythene plastic bag for packaging use to be replaced by environmentally friendly, biodegradable, and compostable material.
Hello, Prof. If you can hear me, you have just 1 minute more for this presentation.
Okay, thank you. Next slide. Another one is the wildlife conservation and trade and trafficking, which I earlier talked about, as to where we've been moving. And even Nigeria is being used as transit cab. Recently, authorities seized about 13 tons of parboiling scale originating from Nigeria between 2016 and 2019. And just this year, about 1.4 tons of parboiling scale were seized, and Nigeria is claimed to be the transit camp. CITES is doing all they can and collaborating with us and FDF and ESRA to ensure that this is stopped. In concluding, I will leave us to this reflective question. What has COVID-19 showed us about our resilience? Resilience is essential and critical to how we respond to issues of environmental sustainability and human well-being. Our ability to anticipate, cope, and adapt. This pandemic outbreak has taught us that any disease outbreak anywhere today could be a problem for the world tomorrow, thus confronting and challenging our proactiveness and responsiveness to act in a timely manner. Thank you. I think I have to stop this way so that somebody else can do other things. Thank you.
Thank you, Professor Adepoju, for the presentation. I thought you were to leave us with the question, but you left us with the question as well as answering the question by yourself. We thank you once again. I have just 3 questions I'm going to put up to you and the Honorable Commissioner for Health. I'm going to start from the Honorable Commissioner for Health. I realized that one of the questions has been answered in the chat room, but for the benefit of people who are using their telephone who don't have access to read the questions, the response that you gave, I was still going to ask you this question. Number 1, to the Honorable Commissioner, is that do you have any strategy going forward? And how do you deploy this strategy for rural and urban poor, especially about the behavioral change that you mentioned, to uptake the wash issues? That's the first question to Honorable Commissioner. The second one is, the participant is from Rafi Guza in Kawo district of Kaduna State. According to him or her, the person wants to know that there seems to be concentration of health facility in urban area in Kaduna State. So the person would like you to update them on what the ministry is doing to extend this facility to rural area. For Professor Adepoju, the participant is talking about the firewood, the use of firewood for cooking and the endangering of our animals that are being killed in the bushes. And you want to know what are we doing to stop the burning of firewood, as also to preserve the animals in the bush. Over to you, the Honorable Commissioner. Do I still have the Honorable Commissioner in the house? While waiting for the Honorable Commissioner, can I have the response to Professor Adepoju? Over to you, Professor Adepoju.
Okay, thank you, moderator. You still have that opportunity to generate more questions and more answers for my question. But let me address the question asked about firewood, which we always tag as woodlot. One, we must be realistic at this point that we cannot completely stop the rural dwellers from exploitation of firewood. And that's why the federal government is exploiting, if you under my presentation about us embracing the gas utilization in the country, which is a project the government is working on. And until we are able to find alternative source of clean cook energy for the rural dweller, they will continue to exploit our firewood. But what we're doing as a stopgap is to plant what we call woodlot. Woodlot is essentially meant for firewood, where they will go and collect firewood from the woodlot. That is the purpose of planting the woodlot. As to those who are burning the animals in the bush, we have also provide, though we cannot reach the entire country at once, what we call alternative enterprise development, which we have done successfully in Ogun State, where we have the single largest forest in Southwest. We have been able to train 200 of the dwellers and also divide them into 4 groups. Look at the animals that they are poaching in those bush and develop them domestically and now empower them with it to do business with it. That's why you can find those who are raising grass cutter domestically, snary domestically, fish domestically, mushroom domestically, rabbit domestically, and all of that. So that is going to be my answer to that. But as soon as we're able to reach the rural dwellers with alternative source of clean cook energy, we think we'll be reducing the exploitation of firewood gradually. And
thank you, Prof.
Thank you.
Thank you, Prof. Maybe you quickly just do justice to these. These participants want to know what your agency is doing about green area, and they said there are few green areas where the poor live, and that what is your agency doing to correct this? And not only even in the poor area, even in cities, I know that a lot of estates do not even have green area. So the participant would like to know what's your agency doing to correct some of this. Over to you.
Thank you, moderator. Before this present administration, there were no specific project to address the green area of afforestation. But this is the second year running that we have a statutory fund to continue to plant. And my honorable minister met with the Governors Forum. That was why I was making comment in my earlier presentation, that at least about 10 states now have been able to sign some gazetted land for Federal Environment Afforestation Program team. And when we talk about green area, there are 2 different areas. We have what we call forest cover, and we have what we call vegetative cover. Vegetation cover includes grass, and while forest cover is strictly shrubs and forest. Where state owns the land, federal do not have any land of their own. But with this current Governors Forum, they have signed pact with us, and we are reaching out to all the states, helping them to revalidate their gazetted document, what we call modeling, to let them know the area that are supposed to be green, or possibly has been taken over by other activities, and compelling and advising that they restore them back to the statutory green area that it was demarcated for. So that cannot happen overnight, but we're working on it.
Thank you very much, Prof. I can see that Commissioner of Health is here. In 1 minute, so that we can go on to the next presentation, we would like you to just do justice to these 2 questions that is overlapping. Do you have any strategy going forward on how do you deploy this strategy for rural and urban poor people, especially about the behavioral change that you mentioned to uptake the wash issues? And lastly, the participant that lives in Kawo district, that is precisely Rafi Guza, seems to, he believed that there's concentration of health facility in urban area than the rural area, and what is your ministry doing to extend this facility to rural area? Over to you, Commissioner.
Okay, so thank you very much, and sorry I was a bit distracted. I was actually answering Mr. Atta's question on the chat. That's why I got a bit distracted. But just to reiterate again that Kaduna State has over 1,099 facilities, and 70% of them are actually in the rural area. And these are variant types. You have the primary healthcare centers, which the government has committed since 2015 to revitalize the PHC according to the PHC policy, one minimum, the ward minimum healthcare package, and 255 facilities, one from each ward, had been identified then, have been upgraded. We're at the tail end of completing that. We only have like 20 that have not been completed. And these facilities are supposed to serve the ward. That should be the ward referral center, working 24 hours a day. And actually in Rafinguza, there is a primary healthcare center, PHC Rafinguza. It's one of those 255 facilities. It's been upgraded. Currently, we've just completed the recruitment of staff for each of these 255 facilities, and we're in the process of procuring the equipments for that. So we do have actually a very wide spread network of PHC facilities across the state. We have one general hospital or secondary facility in each of the LGAs. And we have some LGAs that actually even have two, depending on the size. So the next phase is also to upgrade those secondary facilities and take another set of 255, this time not centers, but clinics. As you know, the health infrastructure, there hasn't been a lot of investment in health infrastructure, and we acknowledge that some of them are really in a bad condition. But if you have 1,099, you agree that it has to be a phased upgrade and renovation. And that's why we're starting with the centers, because the centers will now serve the whole ward and will be open 24/7, while we're doing the upgrades in the lower level facilities. And each one of these centers should have 4 to 6 clinics that feed into it. So that's I hope I've answered his question. There was a second follow-up question about COVID testing, which we're guided by the National Strategy on Testing, and that recommends that we have a test collection center in every LGA. So far, all the general facility lab staff have been trained in sample collection, and we're working to establish, to get our gene expert machines working. We have 12 in the state, so that these tests can actually be done at the local level. We know it doesn't cover the whole state, but so far we already have 3 major PCR labs that are working. But the idea is to have the collection facility at the LGA and link it up with the labs and have these tests done within 24 to 48 hours. And decentralize the actual management of COVID patients to the LGA level, which means that we equip the secondary facility to be able to see cases that are mild to moderate, and any complicated cases now get sent up to the state level, where we have the isolation centers, of which we have 5 now. On the strategy for getting the community to own the COVID response, the state has launched the Forward campaign, and these are premised on key public health actions that the community will now continue to own. I don't have, I was trying to get a poster of the Forward campaign, and it's just it talks about forward wearing masks, hand washing, making sure that you give distance, the required distance between people, to avoid crowds, to continue staying at home if you don't have to go out and it's necessary, and to make sure that you have a robust diet that will support your immune system to help. I'm not sure you can see this properly, but this is what the Forward campaign is about. And it's emphasizing personal responsibility. And we're marrying that with all the community structures we have in place already. We have a very good structure that has been used for polio eradication. And these are in almost every settlement. And this is what we hope to leverage on to get this behavior change to people at the grassroots. I'm sure most people have noticed that the people in the rural areas are just going about their business. A large chunk of them don't even think COVID exists. And if it exists, they think it exists for the elite. So using these community structures, we hope to leverage on their expertise and their connections to make sure that we move the campaign forward.
Thank you.
Personal responsibility. Thank you.
Thank you, Honorable Commissioner for Health, Kaduna State. We need to really rapidly move forward. We are going to look at the importance of food. As you know, healthy food provides us the nutrients and energy to develop and grow, and to be active and to move, play, and do all sorts of things that we really need to do in life. And there's no other person that will be helping us to do justice to this other than the managing partner, Sahel Consulting Agriculture and Nutrition Limited. She'll be looking at cautioning the effect of food to prevent undernourishment, which makes the general population more susceptible to diseases. I'm going to call on Madam Ndidi to please do justice to this for the next 7 minutes. Thank you, and over to you. Do I have Madam Ndidi in the house? While waiting for her, I think we need to move forward to look at issues relating to quality education. And we'll be talking about basic components of quality educational provision and how to sustain them during post-COVID-19. And one special person that will be doing this for us is the CEO and founder of Million Teachers. I'm going to just give 2 seconds to him to give us the meaning of 1 million teachers. I think I'm interested in this because UNESCO work very well when it comes to the issue of teachers, quality of teachers, and so on and so forth. So I'm going to call on Mr. Akim Subar to speak on the basic component of quality educational provision and how to sustain them during post-COVID-19. Over to you.
Thank you very much, sir. It is indeed a great privilege to be here. Please, can I share my screen?
Oh, right. Go on, please.
Okay, I would like to share my screen. Okay, please, can you confirm if you can see my screen?
Confirm.
Okay.
Yes, we can see.
Okay, this is 7:11 a.m. from Canada. Good morning, everyone. Thank you, the moderator. Thank you to the officials of Bako Kotagora Development Foundation for the privilege of being part of this discourse. I wish to also convey my respect to the previous speakers, including the DG, Professor Adepoju, and Dr. Amina, the Commissioner for Health. I think my task is very simple. I'm asked to speak about the components, the basic components of education provision and how to sustain them. And also just to quickly take you back to the meaning of 1 million teachers. So 1 million teachers over the next few years, our objective is to provide training for 1 million teachers, exactly what our name signifies. But we're doing it in a different way, recognizing that The whole teacher development program goes beyond training. And we also wanted to do it in a sustainable manner, such that teachers are actually the ones taking ownership of this process. I would try to go through my presentation. Hopefully, if there's some time, I can dive in further into what we do. In summary, there are about 5 essential components of basic education. And the first one is having prepared learners. And one thing that we have been impressed about is the school feeding program, because this is one of the components that ensures that learners are prepared and they have the right nutrition for them to be able to pay attention in the classroom. So the absence of these severe deprivations and harsh environments associated with poverty really undermine early childhood learning. So this is a key component of having quality education. When students see school as a safe haven, where they know that they can get decent meal, where they know that a lot of the facilities that they need for learning are in place, we can begin to talk about having decent education. So the first one is prepared learners. The next one is having skilled and motivated teachers. So I'm sure you will not be surprised that this is something that we are really working on at 1 million teachers. But it is essential that we have skilled and motivated teachers, recognizing that teachers are the most critical, most important factors for enhancing learning in schools. If we do not have skilled and motivated teachers, learning does not take place. And the next one is having adequate inputs. These days we're talking about technology, we're talking about kids having devices, tablets, mobile phones and whatnot, and being able to access internet, to access information that they need to support their learning. But it goes beyond that. We also have to consider having decent classrooms, having desks and chairs and other implements, writing material, whiteboard, and all of those kind of things. The next one that is very relevant is effective school management. And one thing that we found out early on when we started working on our program is the fact that, yes, it would be nice to have motivated, very well-trained teachers, but ultimately effective school management can undermine all of these efforts if the leadership at the school level does not have the competence, does not have the training to do work effectively. It undermines the whole experience. So providing effective school management and governance in a way that it benefits the learner and teacher relationship is very key as one of the basic components of for providing education. Another one is having stakeholders aligned to make the whole system work, because and we've seen this situation in various settings in Nigeria. We have the SUBEB, we have the Ministry of Education, both at the state and the federal level. We have the Teaching Service Commission. We have all kinds of stakeholders. We have the NUT. But most important is, if they're not working in alignment, it is very unlikely that we will achieve the goals of education. So this is very, very key in providing basic education for the students. So I would like to pause a little bit and just reflect on how COVID has affected learning. First of all, before COVID, we've had a learning crisis in Nigeria, and I don't think I need to kind of rehash. We're all aware of all of the challenges that go with education in Nigeria. And then COVID came, and worsened the whole situation. Nigeria today, I think as of 2016 or thereabout, according to UNESCO, has about 10.4 or so students out of school, majority of which are girls. This is out of a global figure of maybe 263 million. We now, with COVID, we have a situation where a majority of these students, including the ones who were going to school, couldn't access schooling anymore. So we were talking about huge learning crisis in the past, and then COVID came and worsened it. And kind of threatening to reverse all the gains, all the efforts of the government at various levels in making sure that we have quality education. We believe that in order for us to even begin to reverse this learning crisis that we have in Nigeria, we need to come up with solutions, and some of which I have highlighted earlier in my presentation. But essentially, most of these solutions should be solutions that center around the teacher, given that teachers are the most significant, the most valuable resource when it comes to enhancing student learning. How do we ensure that we close this gap? How do we ensure that not only do we close this gap, but we have quality teaching? I wanted to get to this point before I begin to talk about the work that we do at 1 Million Teachers. And that's the triple challenge that we set for ourselves early on when we started. UNESCO stated in a recent report that by 2030, we would have a shortage of 69 million teachers globally. And the bulk of this problem is in sub-Saharan Africa, and Nigeria being a significant part of that population. The challenge we set for ourselves is, how do we attract new teachers into the profession, and how do we ensure that these teachers, the ones already existing and the new ones coming into the profession, have the skills to be able to do the work that they have been hired to do. And then finally, how do we ensure that they have the motivation to do this work? And and this is very well known, the welfare available for teachers in many developing countries that has ensured that strong candidates are not attracted into the profession. So whatever we do in reversing this learning crisis that we have, exacerbated by the COVID pandemic, means that we need to redouble our effort, starting with development organization playing a key role, governments really stepping up their game, both at the local, state, and the federal level. So attracting candidates and providing them with the foundation of subject and pedagogy, how to teach, and then making sure that they receive the ongoing support that is necessary for them to become better teachers, providing them with mentorship, motivating them. So that is key to reversing the crisis. Just taking you back to the components again, having ensured that we have prepared learners. I talked about initiatives like the homeschool school feeding program that provides, nutrition, necessary nutrition for kids, so that they can develop appropriately in order for them to be able to absorb the knowledge that is being transferred to them. Having skilled and motivated teachers, providing adequate school input, ensuring that we have effective school leadership, and making sure that all stakeholders in the system are working together for the common good in a relationship that puts the learners, that's the students, at the heart of learning and teaching, and making sure that teachers have a skill set to be able to do the work that they have been employed to do. So thank you very much for your time, everyone. I would stay behind to answer whatever questions that you may have.
Thank you, Mr. Akim Subar. I sincerely want to say a big thank you once again for this presentation. And what thrilled me about this presentation is the solution angle of it. And that is centering the solution to the teachers. And we talked about motivation, we talked about the welfare, you talked about the facilities, and you have not said anything wrong when you have talked about the alignment of stakeholders, including the government and the international organization, to be able to provide this solution. And one other thing that you said that I like to reiterate is the fact that we are going to lose a lot of teachers, especially after the COVID-19 pandemic. I have seen several teachers that have actually resigned from their profession just because the schools cannot pay them, particularly the private school that has been complementary to the government effort in providing basic education to our children. A whole of them for the last 6 months have not been able to pay the teachers, and you can't say the teachers should continue to go hungry. As such, what they did was to just put down their resignatory papers and look for something else to do. And this is not good enough for the education of our country, and in Africa particularly, like you rightly said. I want to say once again, thank you for this presentation. And I know that more questions will come in thereof. I'm going to just quickly continue, since we are talking about education, and we have another senior educationist in the house, Dr. Onifesi Suraj. He's a senior lecturer from the Department of Mass Communication from the University of Lagos. He's going to look at the strategies and the program that to ensure that COVID-19 does not have an adverse effect on primary school completion. Not only primary school, but also the secondary school. But here he's looking at the primary school to the progression of secondary school, and the progression of secondary school to the university or to tertiary education. Dr. Onifesi Suraj, over to you, and thank you once again, Mr. Akim. Over.
Thank you, Mr. Macaulay, my wonderful moderator. I hope you can hear me.
Very well. You are loud and clear. You are loud and clear.
Thank you so much, and let me thank also the organizer of this program, the Bako Foundation, and also those who have spoken before me, the commissioner and the prof, and the other